People always ask, is the electronic record going to save me time? I don't think you can say it saves time. It does give you more control over your time, but I can say definitively that it makes me a better doctor. You know, there are always times that you don't finish writing a note or finish within the confines of a 9-to-5 day. And having an electronic patient record allows me to go home, have dinner with my family, put my kids to bed, and then finish those things up.
In explaining the EHR and the benefits of it to a physician, they tend to fall within one or multiples of three groups. Those who are interested in everything that they can do to improve patient care, those who are concerned about the economic aspect of it. Am I being reimbursed at the level that I should? And those who are really concerned about their quality of life. The nice thing is that there are aspects of the EHR that can help and improve upon all three of those.
It was a constant thing that a chart would go missing and then you have to go hunting around for the charts, but this is one thing that certainly has made life a lot easier. Especially for patients that have been within the practice for many, many years, their charts get incredibly thick and it's very difficult to sort through and find the relevant information.
Now, with an electronic patient record, all of that information is there at the point of care.
I don't have to worry about patients losing lab slips anymore. Sent electronically to the lab, the patient just shows up there, checks in, gets their blood drawn, and afterwards the results get sent back to me. And a results letter can automatically be generated to go back to the patient after I've had the chance to review it. Clearly, one of the key essential features of the electronic medical record is the ability to e-prescribe.
And you send it to the pharmacy of their choice, which is actually very easy to choose. They essentially tell you CVS or Harris Teeter, and you put it in, and it goes directly to that pharmacy, so when they come to pick it up, it's already ready.
To each individual patient, and it has their formulary information right into the patient chart as well.
It will give you either a smiley face, a neutral face, or a frowny face, and that sort of tells you that that particular insurance will either cover it fully or actually has a large copay.
One of the things that we actually looked at here at the MFA is when patients had their medications e-prescribed, they were more likely to attain their NCEP ATP3 goal for their cholesterol than those patients that had their prescriptions handwritten. Patients that had their medications e-prescribed were more likely to have a lower cost medication prescribed, and they're more likely to take it.
I think the fact that I can access the patient record anywhere that I can access the internet has had a huge impact. If I'm on call and a patient calls with a question or concern, I can access their record. It not only does it allow me to make a better on-call decision, it makes it much easier to document what's done on call so that if they're seen by their own physician, what we've done is already documented.
Having an electronic health record has definite benefits from a clinical aspect, but the cost savings are tremendous. Incorporating these processes has really translated into increased cash in the door and improvement on the accounts receivable. These are real dollars in the door, an improvement that you can count on. You can imagine getting payment back in the door 14 days from a commercial payer. What a tremendous benefit and availability of cash that provides to your practice.
I mean, I think we're entering an environment where people are going to be judging our care based on our outcomes. And it's really very hard to track outcomes without an electronic record.
Medicare is actually going to decrease payments to physicians who are not using an electronic health record.
I don't ever want to practice in a paper handwritten chart environment again. It would not only be painful, I think that patient care would suffer.